Here I'm going to talk about few board review questions and answer, and that is frequently asking in NCLEX board. And before to start the question, I want to share with you, human brain is a supercomputer, and what we are thinking 24 hours a day or 7 days a week, and what we self-talk to our brain, and it is the programming that it will run. So it is important before to think what I will think. The question here, a non-pharmacological intervention should a nurse include in a care plan for a client who has a moderate rheumatoid arthritis? Select all, apply. So examiner asking this question about the rheumatoid arthritis. So rheumatoid arthritis is a chronic inflammation or inflammatory disease that is affect the joint, and this result in the painful joint, swelling of the joint, and stiffness in the joint. So about the rheumatoid arthritis, out of 4 options, which is the correct? Select all, means more than one answer. Massage in the inflamed joint, avoiding the range of motion exercise, applying the splint to inflamed joint, using assistive device at all the time, selecting the clothing that has Velcro faster, or apply the moist heat to the joint. The correct answer said number 3, applying the splint to inflamed joint. Because in rheumatoid arthritis, sometimes patients complain the deformed joint or deformities. So it is very important to educate the patient, right? Or education, so what they should do. And also number 5, selecting the clothing that has Velcro fasteners. So we use a special kind of device or cloth that can prevent the deformity of the joints. Also number 6, applying the moist heat to the joint. So nursing care plan is important. Okay. So always keep note if arthritis, assess the patient vital sign, and also we keep the observations. So rationality, supportive or non-pharmacological measure for the client with rheumatoid arthritis include applying the splint to the rest inflamed joint, or using the Velcro fasteners to the cloth to aid in dressing, and applying the moist heat to joints to relax the muscles and relieve the pain. Inflamed joints should never be massaged, or because doing so can aggravate the inflamed. So we will not do the massage. The physical therapy program include a range of motion exercise or carefully individualized therapy exercise, or prevent loss of joint functions. Assistive device should be used only when marked loss of rest or motion movement. So it is very basic about the rheumatoid arthritis. Next question, a client who 7 months of pregnant and report the severe leg cramping at the night. Which nursing action would be most effective in helping the client to cope with this cramping? Number one, suggesting that she walk for 1 hour twice per week. Also advising her to take over the counter calcium supplement twice per week, or teaching her to dorsiflex her foot during the cramp. Number four, instructing her to increase milk and cheese intake to 8 to 10 serving per day. The correct answer said teaching her to dorsiflex food during the cramping. So you can see this is the dorsiflexion and opposite is called plantar flexion. So we educate patient. If patient complain the cramping at leg at the night, do the dorsiflex foot. So dorsiflex is the action of raising the foot upwards towards the chin. It means the flexion of the foot in the dorsal or upright, right? It is upright direction. You can see the picture. So usually people use the dorsiflex when they walk and during the middle stage of weight bearing or just before pushing off the ground. The plantar flexion in relation to the dorsiflexion, the plantar flexion actually opposite. So the main difference between dorsiflex and plantar flex, the dorsiflex is the action which is decrease the angle between the legs and dorsum of the foot, whereas the plantar flexion is the action which is decrease the angle between the back of the leg and sole of the foot. What else? The rationale said the common during the late pregnancy leg cramping cause the shortening of the gastrocnemius muscle in the calf. Dorsiflexion or standing on the affected leg extend that muscle and relieve the cramping. Although moderate exercise promote the circulations, walking 2 hours daily during the third trimester is excessive. Excessive calcium intake may cause hypercalcemia or promoting leg cramps. The physician must evaluate the client needs for calcium supplement. If the client eats a well-balanced diet, calcium supplement and additional serving of high calcium food may be unnecessary. So what next? Next question here. A nurse had just removed an IV catheter from a client arm because the fluid has infiltrated the arms. The physician ordered warm soap for the area. Based on the principle of heat and cold application, the nurse should do what? Number one, keep the area covered with a warm shock. Remove the warm compress for at least 15 minutes after each 20-minute applications. Number 3, alternate warm compresses with the cold compresses. Question the order because the heat increases the edema. The answer is we remove the warm compression for at least 15 minutes after the 20-minute applications. In this picture, we can see a catheter, right? So when a patient have it, we always cover the cannula, that is insertion site, with a sterile, transparent, semi-permeable occlusive dressing, the side white one, right? Always remember, place the using an aseptic non-touch technique over the catheter to prevent the infection. And also, if patient have it, it is important continuous observations of the site to help the stabilize and secure the catheter and prevent infection is the most important of the patient. Rationale said because heat and cold can injure the skin, either should be applied for only a limited time, and warm compresses increase the circulations and promote the fluid absorptions in the infiltrate area. Removing the compressions every 20 minutes for at least 15 minutes prevent the injury to the skin and subsequent rebound vasoconstrictions. Cold compression, which help to reduce the edema or cause the vasoconstrictions. Keeping the area covered continuously can lead to the skin breakdown. Next question here. A client who has suffered a compound fracture and is preparing for discharge to the bone. During the teaching session, the client asks why she needs antibiotics for a broken bone. Which response by the nurse is the most appropriate? Number 1, antibiotic therapy has been prescribed as a precaution between your bones was exposed to the environment at the time of your injuries. You may discuss your prescriptions with your physicians at your follow-up appointment. Number 3, if your temperature is normal for 48 hours, you may discontinue the medications. Number 4, antibiotics will help to the bone to heal. The correct answer said antibiotic therapy has been prescribed as a precursor between your bones was exposed to the environment at the site of your injuries. If you read this question, examiner asking compound fracture, right? What is compound fracture? So in this picture, we can see different kind of fracture. If the fracture like this, transverse, we call transverse fracture. If the fracture look like the liner, we call linear fracture. And if the fracture like oblique, we call oblique but non-displaced. This is the oblique and displaced, so called oblique displaced fracture. And this is the example of spiral fracture. And this is the green stick fracture. And here, bones is broken different pieces. We call comminuted fracture or compound fracture. So compound fracture an injury in which a broken bones divided into pieces, the skin, and causing a risk of infection compared with a simple or transverse or oblique fracture. So here the first simple fracture with the two pieces, and here comminuted fracture in several pieces, right? So our compound fractures. So keep it note, when in like this picture, a partial or complete broken in a bones in several parts, or this patient have a severe pain and swelling in the injured locations, right, indicate the fracture. So in that kind of compound fracture, we need always antibiotics because of healings. So they said rationale, the nurse should tell the client that antibiotics are prescribed as a prevention measure for a client with a compound fracture, because such fracture exposed to the bones to the environment and possible infections. Telling the client to discuss his medication with the physicians at his follow-up appointment does not address the client questions or immediate needs. The client needs the medications regardless of his body temperature. Antibiotics do not help a bone fracture to heal. So if a patient comes with the fracture like this, with compound fracture, so nursing care of a patient with the fracture include the nurse should instruct the patient regarding the proper method to control the edema and pain, because this kind of patient also complain the edema and severe pain. So it is important to teach exercise to maintain the health of the unaffected muscle and to increase the strength of muscle need for transferring and for using assist device. Next question here, current, the correct landmark for obtaining the apical pulse is the, so number one, location of apical pulse where left fifth intercostal space, mid axillary line, right? Not axillary line. Left intercostal space, mid clavicular line. Number three, left second, no, mid clavicular line. Four, left seventh, no, intercostal space, mid clavicular line. So correct answer, left fifth intercostal space, mid axillary line. So in this picture, we can see this is the mid sternal line, This is the mid-clavicular line, and this is the mid-axillary line. So, first of all, our apex beat, right? Question called talking apical pulses. So, apical pulse is the pulse over the top of the heart, this area. Typically, we heard through the stethoscope with the patient lie down on his or her left side. The heartbeat consists of the two distinct sound, right? Love and dub. So it is where we get it, the mid, the fifth intercostal space, where the mid-clavicular line crossing. So rational said the correct landmark for obtaining an apical pulse is the left fifth intercostal space in the mid-clavicular line. This area is the point of maximum impulse and located to the left ventricular apex. The left second intercostal space is the mid-clavicular line, is where the nurse is ausculted the pulmonic sound. Apical pulse is not obtained at the mid-axillary line or seventh intercostal space in the mid-clavicular line. Next question, talking about the tracheostomy care. So a nurse is assigning to care for a client with a tracheostomy tube. How can nurse communicate with this client? So by providing a tracheostomy plug to use for verbal communication. Number 2, by placing the call button under the client below. Number 3, by supplying a magic slot or similar device. Number 4, by suctioning the client frequently. So definitely we do not do this because chance of oxygen deprivations. So in this picture, you can see we put the tracheostomy. So tracheostomy is a hole that surgeons make through the front of the neck into the trachea or windpipe, easily to say. So tracheostomy tube is placed into the hole to keep it open for breathing. So it is the surgical procedure. So when a patient needs the tracheostomy, as a healthcare provider, it is very important to teach our patient. So we teach our patient how to take care of tracheostomy tube. So when patient discharged from hospital with the tracheostomy tube, we educate them about the tracheostomy tube before go home. Also, routine tracheostomy care should be done at least once a day after patients are discharged from hospital. Normal saline or tap water wash patient hand or our hand thoroughly with soap and water before touch the tracheostomy. And the next here, so in this question, saying by applying a magic slot or a similar kind of device for the communication. So you see the board, they can write and erase it, or we can use some special device, a picture, to communicate. So the major aspect of nursing care of a patient with tracheostomy is communication. In most situations, communication is primarily the nurse initiated and controlled. Patient can use, a bell, or can use some kind of signal or music slot, right? Like this. So Restaurant said the nurse should use a non-verbal communication method such as a magic slot, notepad, or pencil and picture board. Physician ordered a tracheostomy plan when a client is being warned of a tracheostomy. It does not enable the client to communicate. The call button, which should be within the reach at all the times for all clients, can, right? So also it is important for attentions, but does not communicate additional information. I mean, we're talking about the call light or call button. So it is the way to send you the signal for the emergencies, get attention, but not for the communications. And suctioning client, number 4, this clears the airway, but does not enable to the client for communication. What next? Next, a nurse is caring for a client who had a stroke. Which nursing intervention promotes the urinary incontinence? So this question about the stroke, right? So what is stroke? And stroke occurs when the supply of the blood to the brain is used or blocked. And when blood supply blocked or reduced to the brain, which is prevent the brain tissue from getting oxygen and nutrition, and brain damage occur. So what it is, encouraging intake at least 2 liters of fluid daily. Number 2, giving the client a glass of soda before bedtime. Number 3, taking the client to the bathroom twice a day, per day, and also consulting with a dietitian. So which nursing intervention promote urinary continence? So right answer is encouraging intake of at least 2 liters of fluid daily. So encouraging a daily fluid intake of at least 2 liters help fill the client's bladder, therefore promoting bladder retaining by stimulating the urge to void. The nurse should not give the client soda before bedtime. Soda acts as a diuretics and may make the client incontinent. The nurse should take the client to the bathroom or offer the bedpan at least every 2 hours throughout the day. Twice per day is insufficient. Consulting with a dietitian would not address the problem of the urinary incontinence. So the nursing intervention is very important for the stroke patient. So we provide the counseling and support to the patient, encouraging the family member to interfere the services. Also involve the other in patient's care, teach the stress management. Also also we will educate about the techniques and maintenance of the personal health for family coping. So now here some note about the nursing care of stroke patient. First of all, system-based approach to the nursing care, like respiratory system, prevention of atelectasis and aspiration pneumonia is important. Neurological, so neurological scale, Canadian neurological scale we should use. Safety prevalence important. So we always, safety is a priority, and we always try to prevent the falling. Also cardiovascular assessment of dysarrhythmia, or we try to prevent to develop deep vein thrombosis. We give them prophylaxis medication. What else? Musculoskeletal system maintain the optimal function through the splinting or motion exercise. Also, adequate or appropriate positioning. Intragumentary system prevent the breakdown through the assessment and careful care of the skin. GI, gastrointestinal, prevention of constipation. GU, gastrourinary. So we should prevent the skin, prevent the skin breakdown, right? Also, it is good to prevent incontinence. Bladder training is important. Nutrition, so oral care, enteral nutrition, parental nutrition is important. Also consult for the swallowing or gag reflex or speech. Psychosocial care, including communication, sensory, perceptual alteration, we should evaluate and also help how to coping with the conditions. Also, it is important care of the family members and caregiver. So, next question here. A nurse suspect that a child age is 4 is being neglected physically. Best assess the child nutritional status, the nurse should ask the parents which questions. So here, number 1, has your child always been so thin? Number 2, is your child is a picky eater? Number 3, what did your child eat for breakfast? Number 4, Do you think your child eat enough? So this question about the find out nutritional status, the correct answer is, what did your child eat for breakfast? So nutritional status is the current body status of a person or a population group. It is related to their state of nourishment, basically. So restaurants said the nurse should ask what the child ate for breakfast in order to obtain objective information about the child's nutritional intake. Asking the child has always been so thin if he is a picky eater or if she eats enough would elicit the subjective replies that would be open to the interpretation. Next question here. When caring for a client who is being treated for hyperthyroidism, the nurse should do what? Number one, provide extra blanket and clothing to keep the child warm. So, and number two, monitor the child for sign of restless, sweating, or excessive weight loss. Weight loss. Number three, balance the client period of activities and rest, encouraging the client to be active to prevent constipation. So hyperthyroidism, weight loss, but metabolism is fast. Patient eat more because of appetite increase, but weight loss, right? Also diarrhea, insomnia, mood swing, palpitation, tachycardia, all is sign of hyperthyroidism. So nurse should, they said, number three, balance the client period of activity and rest. So restaurant said a client with hyperthyroidism needs to be encouraged the balanced period of activities and rest. Many clients with hyperthyroidism are hyperactive and complain of feeling very warm. Consequently, it is important to keep the environment cool and to teach the client how to manage his physical reactions to the heart. Client with hypothyroidism, not hyperthyroidism, complain of being cold and need warm clothing or blanket to maintain a comfortable temperatures. They also receive thyroid replacement therapy, commonly feel lethargic or sluggish, also prone to constipation. The nurse should encourage the client with a hypothyroidism to be more active to prevent the constipation. In this table, we can compare and contrast the sign and symptom of hypo and hyperthyroidism. So in case of hyperthyroidism, we can say everything is hyper, means fast, or patient feel hot. Whereas the T3 and T4 is high, but TSH should be low because of body compensatory mechanism. Patient weight loss, metabolism is faster, patient eat, appetite increase, but weight loss. Diarrhea, insomnia, mood switching, palpitations, tachycardia, heart, also scanty menstruations. So if anybody have a tachycardia or palpitation, automatically anxiety will attack or patient will be restlessness. On the other hand, we can see hypothyroidism, HYPO, hypo, SLOW, slow, and also cold. Patient feel cold. T3, T4 down, but TSS, thyroid stimulating hormone, will go up. Why? Because of body compensatory mechanism. Weight increase because metabolism is slow. Constipation, difficult to spit, depression, bradycardia, but here tachycardia. And hypothyroidism cold, but hyper is hot. Brittle nail, hair loss, and dry skin. So what are the management? In case of hypothyroidism, patient T3, T4 go down. So you have to give them T3, T4. And this is called synthyroid. Other name is called levothyroxine. Easy way to remember hypothyroidism medication name is LEVO, HYPO, hypo. Other name is synthyroid, SYNTHOROID, synthyroid. Before to prescribe or give this medication, which is always important to check the vital sign, particularly pulse rate. So we should hold the medication if the pulse greater than 110. Also educate your patient, this medication takes time to work. At least it takes 1 week to work. Hyperthyroidism treatment, we use profile thiouracil, shortly called PTU, right? If PTU is not enough, we should give radioactive iodine. Or if radioactive iodine is not enough, we go for surgical remove, thyroidectomy. After thyroidectomy, it is important post-operative care. Tracheostomy set should be here. There, oxygen will be prepared. Suctioning machine should be there. Also, calcium gluconate. Sometime during the surgical operation, thyroid gland, the parathyroid gland also removed. So we have to check after the surgical operation, patient develop any kind of tetany, involuntary movement of muscle. It means parathyroid glands also removed, because parathyroid glands release calcium. They release parathormone, that is increase calcium and reduce phosphorus. So the complication of this is called thyroidectomy. So here are the few questions we'll discuss. So one of the Greek scientists said, I cannot teach anybody anything. I can only make them thinking. So thinking is very important. What we're thinking, it is important to think first. So positive thinking can change your life. And old men say, your brain is a supercomputer, and your self-talk is a program that it will run. Thank you.